Hello, everyone. Good morning. Thank you for joining our International Student Mental Health webinar. A bit about me first. I'm Lucy. I head up our global partnership team at Studee, and I'm also a qualified mental health first aider. As well as working at Studee, I volunteer at Women's Aid, which is a UK charity who support women who have suffered domestic abuse and violence. And I personally run mindfulness workshops there for the women who are looking to improve their mental health after these experiences. Through the charity as well, I also work with the universities and I help them enable more students to disclose abuse and seek help when studying. So, here at Studee, we think it's very important to open up the conversation around international student mental health. There's recently been a few reports around the subject, and as we have the privilege here at Studee of speaking to around 30,000 students a month at our advice centre, some of which do confide in us, we think it's a top priority for us. We thought we'd discuss this topic and pass on some knowledge and a few tips which we hope will be helpful. So just a quick look through the agenda. First of all, we're going to start by setting the scene and then we'll go through the following points. We'll have a quick look at some cultural differences, what's in the news, the reports, some feedback from our advice centre, and then give you some best practices. And just before I start, I wanted to mention this webinar does mention the topic of suicide. So please look after yourselves throughout it and please leave if you feel you need to and come back to it at a later date whenever you feel ready. So setting the scene in a global context is important. I think most bigger universities globally will have at least 100 nationalities on campus at once. This will then help us focus and start to understand, is there any trends linked to mental health in certain countries and regions in the world? Are there any trends linked to gender? This will then hopefully allow us to better empathise with our students, male, female, however they identify and wherever they are from. So we contacted the mental health research and evidence team at the World Health Organization, who provided us with their findings in relation to young people and mental health conditions. 1 in 5 young people globally have a mental health condition. So say if your university has 1,000 international students, 200 of those might be having a mental health condition. And for smaller universities, say with 200 international students, you most likely have 40 students with a condition. So then we can start to ask ourselves some questions. Do we know any of those students? Do we know what access to support services they have at the university? Depression is one of the leading causes of disability in the world. So that affects 264 million. That's 38% of the world's population, and that's a minimum. And that's due to obviously the people that don't have access to healthcare, who haven't disclosed their condition, or have got diagnosed. So if we take that stat further and put it into our context, the 200 students that had a mental health condition at a university, 76 of those have depression right now in terms of international students. And for the smaller uni that had 200 international students, 15 of those might be having depression right now. Suicide is the second largest cause of death for young people, and this is a difficult topic to talk about and find the words for. On the subject of language, a top tip: many health professionals, especially here in the UK where we're based, actually don't use the term committing suicide anymore, as it relates back to historically when it was a crime to take your own life. So many professionals prefer to say completed suicide, and there's lots of discussion around language use and the impact of that on the stigma of it. If we have a look at the mental health workers statistic, this really highlights the lack of resources globally for mental health, and it highlights the reasons why every business like us and every institution like yourselves can come together to set up their own support services and start to train their own staff. So let's have a look at the global population. So what you're looking at here is the percentage of people who suffer from a mental health condition. This also includes substance abuse across the world, and then you can see it's broken down by country by the colour. So if you found your country, then you can have a look at the scale down the bottom. So what we can see here is the darker the colour, the dark red, equals the higher number of people in that country with a mental health condition. So what we can see here, so 20% of the population of Australia, Greenland, Iran, parts of the Middle East, and then also America and Argentina also have a high percentage of around 15%. So knowing this can help you start thinking about and focusing on the international students that you might have or might be welcoming from these regions, as they are maybe more likely to have a condition. So it's a good place to start. And then let's have a look at male versus female. As an example, just over 18% when you look at this graph of females in the US have a mental health condition, and that's versus around 16% of males. So this particular map shows globally more females have mental health conditions. But we also must bear in mind from other research, women are more likely to go to a doctor and get diagnosed than men. So it's very likely and important to bear in mind that when talking to male students about mental health, they could find it more difficult to disclose. Let's have a look at some cultural differences towards mental health. As our international students come from different cultures, there's lots of readings you can do about Eastern and Western views of mental health. And here I'm going to show you some simple high-level findings. So Eastern culture, maybe your Asian students as a general example, they will often suppress feelings due to not wanting to affect other people in their lives, while Western cultures will use that suppression as a coping mechanism to distance themselves from their feelings. So reading around this subject might help you understand better the barriers different students from different cultures actually face to disclose their mental health condition. And by better understanding these barriers, we can start breaking them down by approaching the topic in a culturally sensitive way at the university. And so for further reading, if you are interested, I would suggest having a read of this book. It's Mental Health, Race and Culture, and it's written by Suman Fernando, who's a global leader in this field. So what's in the news? What reports have actually been published at the moment? So we're going to look at two reports. The first one is students' mental health in a pre-arrival context, so how they're feeling before they arrive at the university. The second one is students' mental health during their studies, and it's New York University who have done a study of their current international students studying with them. So the first one is through Bupa and another student-focused company. And this was one of the first studies on mental health of international students, and they were travelling to Australian universities. It involved 12,200 participants from 175 different countries. So we've summarised the 8 main findings from this report for you. So 1 in 5 prospective students reported a low life satisfaction, which is a signal of depression. Nearly 60% were vulnerable to depression due to how they scored how lonely they were. And 34% said they didn't have anyone they could access and turn to for support. So if you're recruiting students from Vietnam or expecting any on campus, they scored the highest average for loneliness. Canadian students from Pakistan had the highest life satisfaction, and Nigerian and Ghanaian prospective students had the lowest life satisfaction. So it's something to bear in mind if you are recruiting students from these countries. Then we had a look at it by the level of study. So it's the undergraduate students who have significantly higher levels of anxiety and stress than the postgraduate groups of students. When we look at it by course type, it's the creative students who scored the highest average in terms of anxiety, loneliness, and pressure to succeed. So now we've looked at students' mental health in a pre-arrival context. Let's have a look at some students who are currently studying at university. And it's New York University they're a great case study, some award-winning services to address mental health at their university. So they offer counselling services, routine screening for depression, a 24/7 wellness hotline and crisis response. And let's have a look at the findings. So current international students studying at NYU. These are the main findings. 22% of students reported anxiety that had actually affected their academic performance over 12 months. 55% of students said mental health conditions affected their academic performance for 1 or more days during a 4-week period. And nearly 60% demonstrated signs of depression, and they actually found it hard to look after themselves. Worryingly, this university found a 90% increase in psychological issues linked to students. And interestingly, 75% of lifetime conditions actually develop during the common ages to go to university, so that age group 18 to 24. And I think these percentages are probably a lot higher than we might have thought before. So here's some feedback from our advice centre. The quote I'll show you next is from one of our advisors. It really summarises the anxiety students face pre-arrival. So our advisors help students from the point of inquiry all the way through to enrolment for our university partners. So we come in as this conversion team for universities who are looking to better create relationships with their students pre-arrival to convert more students to enrolment. This means we help and chat to around 200,000 students at the moment every year. I'm going to just read this quote out for you from one of our advisors. So a lot of students have anxiety. It's not easy for them to identify, understand, or express. And when dealing with students in the final process of getting their visa and enrolling, there are some students that are very uneasy about the whole process and need more personal, experience-based, constant advice and reassurance. The pressure of getting the answer they dream of, dealing with family expectations, the idea of failing, the visa sometimes creating more delay in their academic path, and dealing with the risk of spending money and then doubting their overall decision is all the things and all the anxieties that they're carrying before they actually start to travel. So you can ease some of these anxieties by making sure the information regarding support services at the university are really easily available to students to read through before they travel. So they know exactly where to go on arrival or whenever they feel they need to access support if these anxieties or different anxieties return. So we're now going to feed back the webinar poll results. We asked you guys 2 questions that were at the bottom of the screen on the tab called polls. The first one was linked to how many people have in place a plan if a student approaches them. And the second one was about any initiatives that you might run. So let's have a look. So does your university have a mental health procedure for students that want help? 50% said yes and 50% said no. Which of the following does your university do to promote mental health services and initiatives? So mental health checkups, they receive no votes. Mental health fairs, no votes. Orientation sessions on mental health, again, no votes. 14% said mindfulness classes were run, and 85.7% said they promoted their mental health first aiders. So that's great. And really pleased to hear that you have them on campus as well. It's really good news. And also trained student organisation leaders, that also received no votes. So really interesting. So on to some best practices. There was a Guardian article, which is a UK newspaper, about how universities don't assess their mental health provisions. So a good idea might be to survey your students to see what is missing and what they believe to be working and easing any mental health conditions. So we'd encourage you to be proactive towards working to the best processes for your international students. And so we've got 5 best practices to go through now. And this is the last part of our webinar. So agent training. So as we found today, students need to be aware of the support services on offer before they arrive. This might be why they choose your university over another university. So if you use agents, train them on spotting the signs of potential mental health conditions, how to flag this to the university if the student gives them permission to disclose it, and also train them on what actual support services are available for students so they're really confident in explaining this. So we've got an example here. This was conducted by the British Council, which is a free course available on the website Future Learn. And it's specifically for agents about how to approach student wellbeing before they travel. Another top tip on arrival care. So ask your agents if the students are coming through agencies, or their new course tutor if the students are coming directly to you, to follow up with them on arrival and organise some orientation sessions to reassure them that there is no stigma attached to mental health at your university. Some good examples to look at after the webinar are Worcester University in the UK. So these guys were shortlisted for University of the Year, and they have fantastic drop-in services called First Point. And then a US example, Ramampo College, who hold wellness fairs, who are very successful at it. Mental health first aiders. So it's great to hear you guys already have those on campus. But for the ones who don't, have fully trained mental health first aiders among your student-facing staff. There's lots of courses, I'm sure, near you. They're only 1 or 2 days long, and you can gain great practice and knowledge about how to risk assess people, how to signpost them correctly for help, and how to approach someone if they're having suicidal thoughts. And it debunks many myths linked to mental health. So, for example, one of the myths is if you ask someone if they thought about ending their life, then they're more likely to do it. This is completely untrue, and it doesn't plant the seed in their head or the idea. As an example, in the UK, they're organised by Mental Health First Aid. You can train directly with them or through charities like Rethink or Mind. So maybe do some research on charities in your country who offer training. Be language sensitive. So you could collaborate with the language department at your university to provide care and support in their native language. As mentioned previously, using the verb to commit with suicide, many people prefer complete. You might have noticed I haven't used the term mental health problem or mental health issue, and I've used the word condition instead, which is far less negative when talking about this subject. And in general, the term mental health, everyone has mental health. We're just constantly on a spectrum from good to bad mental health. Access to support over the holidays, and this is our last tip of the webinar. So provide access to support over the holiday period, especially relevant now with Christmas coming up. An example is Nightline, which is a hotline in the UK, which is run by students for students in a volunteering capacity. So my housemate at university actually used to do this, so I know it's very popular amongst students. And every night and of every term, trained students actually answer calls and emails and instant messages and chat to their fellow students who need someone to talk to. And due to its success in the UK, the Nightline model has also been adopted by some universities in America and in Canada, Switzerland, Australia, and Germany. So that might be something to look into as well. Thank you so much for joining the webinar today. It's been a pleasure to talk to you. Thank you very much, everyone.